Radiotherapy is a really important treatment for prostate cancer. It's one of the important curative treatments for localized prostate cancer. It has a very important role in treating more advanced prostate cancer and has a role in palliating incurable advanced prostate cancer. In fact, in the STAMPEDE study, in certain patients whose cancer had spread when they first present, delivering radiotherapy to the prostate has been shown to improve survival. So across the range of disease with prostate cancer, radiotherapy is a really important form of treatment in different ways. So when we're talking about potentially curable prostate cancer, radiotherapy and surgery are as effective as each other, but they have very different side effect profiles. So it's important to talk to patients about the short-term and long-term potential side effects of both treatments so they can make an informed decision. In terms of advanced and incurable prostate cancer, radiotherapy either to the prostate or to areas of cancer deposits, such as palliative radiotherapy, is really important in terms of treating unpleasant symptoms and improving patients' quality of life. So when we talk about radiotherapy, we mean external beam radiotherapy using high energy X-rays. We use low energy X-rays to do scans like X-rays and CT scans. Using higher energy X-rays, we can actually kill cancer cells, and that by building up that damage in multiple treatments, we hope to kill off the cancer, cure the patient, and preserve the tissues that the cancer was standing in, as opposed to actually cutting them out. We call that organ preservation. These X-rays are just as invisible as the low energy X-rays you use for taking X-ray pictures and CT scans. So it means that we have to be absolutely sure where these X-rays are going each day of treatment. And there are a lot of measures to do that. The modern treatment for curative radiotherapy for prostate cancer is image-guided intensity modulated radiotherapy. And what that involves is just before each treatment is delivered, we will check the prostate is where we think it is. That's either by doing a quick scan to latch onto gold seeds that have been implanted into the prostate to make sure it hasn't moved. And if it's moved, to move the high energy radiotherapy dose, so that we must always cover the tumor every time we treat the patient. The alternative to that is to do what's called a cone beam CT scan to check the position of the prostate just before the treatment is delivered. So we're using very highly targeted invisible X-rays, but we have to make sure that we're not missing the target each time we're treating our patients. Radiotherapy is an extremely important treatment for prostate cancer. We have tens of thousands of people being diagnosed each year in this country, and many of them will have radiotherapy at some point during their disease. Because it can be a curative treatment in selected patients, that means that radiotherapy is an important contributor to the survival rates of prostate cancer. In fact, we've got ongoing clinical trials in this country and across the world looking to try and improve these treatments and to try and increase the cure rates even further and to decrease the side effect rates. That entirely depends on the nature of the tumor that we're trying to deal with and how far it has spread. We tend to divide curable prostate cancer into risk categories: low, intermediate, and high risk. Usually, low-risk patients are offered active surveillance, and they can remain on surveillance, hopefully for several years, before they eventually need to have curative treatment with radiation, with surgery, or with brachytherapy. Intermediate risk patients with radiotherapy, I typically treat with 6 months of hormone treatment and then 4 weeks of daily radiotherapy to the prostate during the 4th month. The high risk patients, we tend to offer them a longer course of radiotherapy and a longer course of hormones. So those patients will be receiving 2 to 3 years of hormone treatment, and their radiotherapy may last 4 weeks, or in some cases, 8 weeks, Monday to Friday. So the treatment is tailored according to the patient's disease and their particular situation. Yes, radiotherapy is an important part in treating curable prostate cancer. It can also be contribute to patients who've undergone prostatectomy. So patients who've had their prostate removed can have the prostate cancer come back, and giving radiation to the area where the prostate was removed has been shown in 3 large randomized trials to be the best treatment to try and salvage those patients. And there are a number of patients who I see in that situation.